Dr. Keesha, I'm so excited to have you here. Welcome, welcome.
Oh, I'm so glad to be here. Thank you.
Yes, and I was really excited about your interview for my Biology of Trauma Summit because autoimmune is such a big issue when it comes to stored trauma in the body. You know this, I know this, and so I really am very honored that you came and shared your expertise with us.
Yeah, it was great to talk about this. One of my favorite subjects. It's
Yes.
very true. I always say the body is the canvas of the mind. The mind writes
Mhm.
on the body what's going on. So if we can get into a collaborative agreement with that body and have it give us the information that it's trying to give us without us resisting it, then we can reverse autoimmunity. But as long as we feel, like that's not an okay thing, then we'll stay combative with it.
Right. And if anything, like autoimmune is a very combative process that's happening in the body, right? Attacking our own self.
Right. Yeah, we don't want to say we're conquering, crushing, killing, any of those words.
No, not when it comes to our body, especially.
No.
Yeah, it's true. Like we will use these words and without even thinking about it. It just rolls off our tongue. We haven't really thought about what am I saying about myself? Yes. Now, some people may not know your story because you used to be an ICU nurse.
I did.
Yes.
10 years. Yeah.
Yes. And of all the places that is an intense place to work, ICU is one of those. And you started seeing things. So tell us a little bit about your background, your story, and how you even came into all of this autoimmune stuff.
Yeah, I was so driven and was really hard on my body. I was pretty tyrannical with it, and worked in the ICU. I ran marathons, skydiver, was raising 4 children. I mean, it's crazy how much of an adrenaline junkie and perfectionist and also people pleaser that I was. And, it was all about really driving myself and taking care of other people. And my body finally collapsed under that strain. And one day I woke up with 10 pounds of extra just inflammatory puffiness and weight and redness all over my joints. And it was like someone had taken, the batteries out of the Energizer bunny or unplugged me from the wall. I had no energy. I was flattened and got in to see a doctor. And she asked me if I had a family history of autoimmune disease. And I said, oh yeah, I think my grandfather had rheumatoid arthritis, and he actually died at the age that I am right now. I'm 56. And this was in my early 30s when this happened. And he was in a wheelchair, and I think about the life. I actually was just interviewed by somebody else for the last hour and did a presentation of slides. And I sprinkled it with some of the things that I've been able to do in my life, like go to Scotland with my daughter and hike the Inca Trail 3 times and, take people to Africa to do trauma retreats and Peru and India. And, like these amazing adventures of healing and learning to be a citizen of the world. My grandfather couldn't do it from a wheelchair. And it's because there wasn't this kind of information available back then. Right. And I just feel so deeply grateful that I could come back from that doctor's appointment and say, get on my computer and say, there must be another alternative here. There must be a different way, where in a patriarchal medical world that he lived in without the internet, it was do what you're told, right? And so I didn't take the methotrexate. I didn't get the non-steroidal anti-inflammatory drug prescription filled. Instead, I went and I looked for other research and found it, and was able to reverse my RA in 6 months. And part of it was healing some deep trauma from sexual abuse when I was a child. They were very intimately connected. And so, my talk in your summit goes through all of that and how that all works. And
Yep. We even talk about this personality, right? Like there is a classic personality that comes with that early childhood stress, that early childhood trauma, and the adaptations that we did in order to survive, but then they become chronic and those persist because it's become our biology. Yeah, every time I talk with you, Keesha, I'm always amazed at just how similar our stories are, right? Like it was in my early 30s that my body crashed from, all of the strain that I was putting it under and running marathons and out biking and a general surgery resident, and it crashed. And I had my autoimmune markers were high. I tanked. And that's exactly kind of what they told me too was, hey, there's nothing to do. When you get the butterfly rash, come back and we'll officially diagnose you.
Right.
But until then, it's just a matter of time. And I'm like, isn't there anything else I can do? Like, I want to get off of this path. I do not want any autoimmune condition. And they didn't have any solutions and tools for me. So I, just like you, like I went back and be like, no, this is not going to be my life. I've seen enough patients to know that I will have my life very limited. And that is not what I'm going to be okay with. And so, yeah, as you're talking about, hiking the Inca Trail 3 times and all these trips and the family stuff, it's like, yes, like this is what is possible when we do this work and we really integrate the biology piece and the trauma piece that is there and so closely associated with any autoimmune process.
But here's the deal. My dad died in February and a whole bunch of family drama erupted that I would have never seen coming with my brother. He just turned into like this different person and all this abusive stuff started happening. And I was just like, what? And it was so like I had so much grief from it, from losing my brother and my dad at the same time. Guess whose autoimmune markers went back up? And so I said, oh, okay, I need to do something. Like they haven't been up in 26 years. Yeah. And I track all the things that I've always tracked. Like there wasn't really anything else. It was just this deep, deep, deep grief about all of that. Mm-hmm. And so I did I'm getting trained from the Multidisciplinary Association of Psychedelic Studies from MAPS in MDMA assisted psychotherapy. Yep. And I did some of that with a psychotherapist. Guess whose autoimmune markers are back down?
Yeah.
It's like,
exactly.
It's not, autoimmunity doesn't mean that this is an incurable disease process that you have to tote around for the rest of your life. Mm-hmm. And so that's the thing to remember is this is just information from your body saying like how this is what's being processed and what's happening right now. I'm not doing well with it. And I need to tell you about that. Yep. And so then it's up to us to be compassionate and curious and turn toward the body and be super collaborative and go, okay, I hear you. Let's work on that. Right.
Exactly. Yep. Exactly. It's our body trying to tell us something.
Yep.
And this just brings up, so many other things that we talked about in your interview in terms of the things that are important, the lifestyle factors that are really important for maintaining our immune system in a healthy place when it has had this pattern in the past. Because like you've seen, like I've seen, there are times when things flare up because of old traumas getting brought up that, I wasn't expecting that, but there it is. And the body is just such an amazing map and such an amazing source of wisdom for us.
Right. And life will hand us the inevitable challenges that we don't think we can handle. And I mean, Joseph Campbell's Hero's Journey says you just have to find the right mentorship for it.
Exactly.
And then you learn a new skill and lo and behold, there you go.
There you go. Mm-hmm. So of all the people in the world, Keesha, who would be the ones that you would say, like, you really have to listen to my full interview on the Biology of Trauma Summit?
Well, anybody that has got unexplained fatigue, skin rashes, symptoms, or an already diagnosed autoimmune illness, or knows that in their relationship patterns, there's probably some kind of way that they're perceiving and processing information that's causing unhappiness in their relationships that maybe has something to do with their own past stuff.
Yep.
That would be it. Yeah.
Mm-hmm, absolutely. And for those people who are curious about, hey, what is an autoimmune personality? I don't think that I have it, but what is it so that I can be looking for that either in my life, or I guarantee you everybody here knows somebody with an autoimmune condition, and being able to help understand them better would be so useful. So useful. Awesome. Dr. Keesha, thank you. Thank you. It's always good to see you.
Everybody.
All right. And we will